I think it's important to remember that PTSD is a real biological phenomena, that there is a change in the brain. You can actually see using various scanners, such as functional MRI or PET scans. After trauma, sympathetic fibers grow in the brain, extrasympathetic fibers increase in the brain, and then that leads to too much norepinephrine in the brain, which is fight and flight hormone or adrenaline. So the control of that seems to come from stellate ganglia, which is here, and then nerve fibers from here go up to the brain, and then as long as that's maintained, people will have PTSD symptoms. So when we put local anesthetic onto the ganglia, or this bunch of nerves here, it seems to turn off what happened to the brain after the trauma, and that's why a procedure like this can work in 5 to 10 minutes. The effect is seen almost immediately, which is pretty amazing.
So how long does one injection actually last? How long is the impact?
I would say average number of how long the first one lasts is a few months to a year. The next one may last years. We've had an outlier right now. I treated him 13 years ago, and he had 2 stellates. He's still doing very well, and he had a horrible combat trauma, shall we say.
Sure.
Some people need 5 or 6.
And how much does this shot cost?
About $2,000.
$2,000. And what's in the shot?
It's a local anesthetic. We numb up the area.
Okay. So if you compare someone who has PTSD taking typical prescription medications over several years, compare that to the cost of this shot, what's the balance here?
I think there are 2 things to remember. One is the misery of suffering from PTSD. I think you can't quite calculate what that means. I don't know exactly what the drugs cost, but efficacy of medications, unfortunately, is quite low. It also takes a long time to set up, and also the compliance is a big problem. People don't want to take it. There are side effects, plus they don't work as well as you'd like. So our success rate sits in about 80 to 85%, while medications, at least studies I've read, are about 40%. A lot of times because people are not being able to be compliant with it. They don't want to keep taking it.
Sure. And you have a nonprofit to help people get this PTSD shot for free. So we'll link your nonprofit, Erase PTSD Now, to our website. James and Derek, guys, thank you so much. Thanks for getting the word out, by the way. I think it's important. A lot of people who are struggling with PTSD from violent-related situations, and the fact that you have stood up and said, hey, listen, I want to get help. You'll encourage others to get help. And Dr. Lipov, thanks for working with them to not just help them, but hopefully get it to more people in the country who are suffering.
Thank you so much.
I also want to thank,
all right, guys,
thank Dr. Lipov for helping us get the shot baby for people in Inglewood for PTSI.
My pleasure. That's why I'm here, guys.